Question 1. The ICU nurse is caring for a sedated client on a ventilator. The ventilator alarm is beeping persistently for low pressure despite the fact the client is calm and has stable vitals. What is the most appropriate action for the RN to take first? A. Suction secretions. B. Check the tubing for holes. C. Call respiratory therapy. D. Continue to monitor. B. Choice B is the correct answer. If the client's presentation and vitals are stable, the nurse should check for any apparent equipment malfunction. If no air leaks or kinks are immediately identifiable, the nurse should call respiratory therapy or the rapid response team, RRT. Persistent alarms despite stable vitals may indicate the client is trying to talk, is developing a pneumothorax from increased intrathoracic pressure, is biting, gagging on the endotracheal tube, or is experiencing bronchospasms. These alarms should never be ignored or turned off, as they may indicate early signs of a change in the patient's condition. The ICU nurse is taking care of a client who sustained a head injury due to a motorcycle accident. In the morning, the client is responsive to pain and assumes a decorticate position. After 4 hours, which assessment would indicate to the nurse that the client needs immediate intervention? A. The client displays purposeful movement when the nurse performs a sternal rub. B. The client extends his arms and legs when the nurse rubs his sternum. C. The client flails his arms and legs when a noxious stimulus is applied. D. The client moves his fingers upon request. Answer. B. Choice B is correct. Extension of the arms and legs indicates decerebrate posturing, an indication of increased intracranial pressure. The nurse should intervene when the client displays this. The nurse is assessing the patient who is 1 hour post-esophagogastroduodenoscopy, EGD. Which finding should the nurse identify as the highest priority to report to the provider? A. Temperature of 101.5 F. 38.6 C. B. Patient reports a sore throat. C. Patient's indwelling catheter has 300 milliliters of clear yellow urine. D. Patient is currently eating ice chips without difficulty. Ask. Highest priority finding to report for patient. Problem. 1 hour post-EGD. Solution. Findings that could indicate worst potential outcome for the patient are correct. A. Temperature may indicate infection and potential perforation. B. Incorrect. Sore throat is expected. C. Incorrect. 300 milliliters of clear urine is normal. D. Incorrect. Eating ice chips without difficulty is normal. Which adverse effects should the nurse monitor for in a hospitalized patient with an order for aspirin 325 mg every 6 hours with a diagnosis of cluster headaches? Select all that apply. A. The presence of dark melana in the stool. B. Decreased heart rate. C. Increased ecchymosis noted on the extremities. D. Increased blood pressure. Tinnitus noted on an exam. Ask. Adverse effects of aspirin. Problem. Aspirin, antiplatelet, greater than easy bleeding, big risk for toxicity. Solution. Adverse effects, things that are side effects, not normal, something that can harm the point. A. Correct. Dark stools can indicate bleeding in the GI. B. Incorrect. Decreased heart rate not an adverse effect of aspirin. C. Correct. Bruising can indicate bleeding from antiplatelets, decreased clotting. D. Incorrect. Increased blood pressure is not effect of aspirin. E. Correct. Tinnitus can indicate toxicity greater than toxic kidneys and toxic ears. A patient with bleeding esophageal varices has had a Sengstaken-Blakemore tube placed to help prevent and control bleeding. What should the nurse do first if this tube becomes displaced? A. Auscultate patient's bowel sounds in all 4 quadrants. B. Immediately raise the head of bed to at least 30 degrees. C. Promptly trim the tube and deflate the balloon. D. Quickly call the medical response team. Ask. Priority action or what to do first. Problem. Esophageal varices bleed and tube is coming out. Solution. Actions to do right now to prevent patient from choking. A. Incorrect. Listening to bowel sounds does nothing for patient's airway. B. Incorrect. Raising head of the bed 30 degrees does nothing for the patient. C. Correct. Cutting balloon. Deflating it keeps airway patent and keeps patient from choking on the obstruction. D. Incorrect. Calling for medical response does nothing for the patient right now. The nurse is completing a percutaneous endoscopic gastrostomy, PEG, feeding on a patient who had the PEG tube placed 1 week ago. The nurse notices that the tube has become dislodged. What is the priority action? A. Apply sterile gloves and reinsert the PEG tube into the existing tract immediately. B. Prepare to insert a Foley catheter into the PEG tube incision site. C. Immediately notify the primary care provider who placed the PEG tube. D. Obtain a nasogastric tube, NGT, for medications and feedings. Ask. Priority action of what to do now. Problem. PEG tube dislodged with feeding greater than think PEG tube needs to be replaced ASAP since hole closes fast. Solution. Correct actions by the nurse to prevent worst possible outcome of PEG tube hole closing. A. Incorrect. Outside of nurse's scope of practice. B. Incorrect. Not appropriate to use Foley catheter in the incision site. C. Correct. Contact HCP immediately to make them aware and replace tube. D. Incorrect. Need order for new feeding tube. The registered nurse reviews the documents below and begins the infusion of KCl at 50 ml per hour into the patient right forearm IV. After the infusion begins, the patient reports stinging and pain at the site. What is the nurse's first action? Laboratory results. Potassium 2.5 MEq. L. Medication administration record. MAR. 20 MEq potassium, KCl, in 100 ml of normal saline to infuse over 2 hours IVPB. A. Apply an ice pack at the IV insertion site for comfort. B. Stop the medication and check for any signs of infiltration. C. Immediately stop IV medication and notify HCP. D. Slow the rate of infusion by half and notify HCP. Ask. First action. Problem. Stinging pain at the site of an infusing KCl, potassium chloride, solution. Anything that burns or stings at the IV site. Always stop the infusion and assess client or slow the infusion and assess client. A. Incorrect. Always stop and assess any IV causing the problem. B. Correct. Stop and assess. C. Incorrect. Stop and assess client, not stop and notify the HCPD. Incorrect. Slowing the rate of the infusion may only be done after you stop first and assess the client. Which assessment findings does the nurse expect in a client who is non-compliant with their treatment plan of chronic congestive heart failure? Select all that apply. A. Blood pressure of 160/96 of a millimeter Hg. B. Crackles in the bases of the lungs. C. Elevated central venous pressure. C. Jugular vein distension. E. Pitting edema of the lower extremities. Ask. Expected assessment findings. Problem. Client who's non-compliant with their heart failure treatment plan. Solution. Manifestations of fluid volume overload. A. Correct. High blood pressure. High fluid equals high pressures all over the body. B. Correct. Crackles. Wet lungs. C. Correct. High CVP. High pressures all over the body. D. Correct. JVD5. Correct. Peripheral pitting edema. A client with Addison disease presents with abdominal pain. The client experiences a decline in systolic blood pressure of 30 mm Hg, has a heart rate increase from 75 to 100 per minute and develops new confusion. Which actions should be implemented in order to prevent the Addisonian crisis? Select all that apply. A. Give prescribed hydrocortisone 100 mg IVP. B. Administer morphine 2 mg IVP every 2 hours for pain. C. Begin potassium 40 mEqPO every 12 hours as prescribed. D. Start an IV infusion of normal saline with 5% dextrose. E. Give Phenergan 12.5 mg IVP every 4 hours PRN nausea. Ask. Actions to prevent this Addisonian crisis. Problem. Client has Addison's disease with abdominal pain, systolic blood pressure that is dropping by 30, heart rate increasing by 100 and they're getting confused greater than Addison's. Add steroids, treat dehydration, dextrose IV. Solution. Interventions that the client needs right now. A. Correct. Hydrocortisone is a steroid. B. Incorrect. Morphine does not prevent the problem. C. Incorrect. Potassium is high. Client don't need more. D. Correct. Fluid and dextrose is needed to prevent dehydration and for hypoglycemia. E. Incorrect. Phenergan does not prevent the problem here. Which clinical manifestations would be observed in a client with Cushing syndrome? Select all that apply. A. Easy bruising. Increased blood glucose. B. Increased blood pressure. C. Increased potassium. D. Increased abdominal girth. E. Decreased weight. Ask. Clinical manifestations. Problem. Cushing syndrome. Too much cortisol. Solution. Findings that are expected. A. Correct. Easy bruising from loss of collagen from high steroids. B. Correct. Hyperglycemia from cortisol. C. Correct. Hypertension from metabolic changes. D. Incorrect. Hyperkalemia or high potassium is from Addison's. E. Correct. Central obesity from too much cortisol. F. Incorrect. Decreased weight is with Addison's. Which clinical manifestations can be associated with a diagnosis of primary adrenal insufficiency, Addison disease? Select all that apply. A. A tanned-looking skin color. B. Anorexia and weight loss. C. Increased body or facial hair. D. Orthostatic hypotension. E. Purple or red striae on the abdomen. Clinical manifestations. Problem. Addison's disease. Absence of steroids. Solution. Signs and symptoms seen with Addison client. A. Correct. Added pigmentation because of increased ACTH. B. Correct. Loss of appetite and weight loss is present. C. Incorrect. Increased body with Cushing's. Clients are usually big, round, and hairy. D. Correct. Orthostatic hypotension is present, everything is low. E. Incorrect. Striae is seen on clients with Cushing's. Which clinic client would be most important for the nurse to call the health provider about first? A. Patient diagnosed with Addison disease taking a new prescription of corticosteroids and reporting changes in mood. B. Patient who needs to have a refill of their levothyroxine medication called into the pharmacy. C. Patient with hypothyroidism who has new onset of fever with a temperature reading of 101.5 F, 38.6 C. D. Patient with type 2 diabetes mellitus who reports blood sugars of 220 to 275 mg per deciliter, 12.2 mmol, L 15.3 mmol, L, in the past week. A. Patient diagnosed with Addison disease taking a new prescription of corticosteroids and reporting changes in mood. B. Patient who needs to have a refill of their levothyroxine medication called into the pharmacy. C. Patient with hypothyroidism who has new onset of fever with a temperature reading of 101.5 F, 38.6 C. D. Patient with type 2 diabetes mellitus who reports blood sugars of 220 to 275 mg per deciliter, 12.2 mmol, L 15.3 mmol, L, in the past week. Which precautions is a priority to teach a 29-year-old female client treated with radioactive iodine for hypothyroidism? Select all that apply. A. If you are breastfeeding, you may continue to do so when you get home. B. Disposable eatery tools should be used for your meals. C. Wash anything you use separately from the rest of the family. D. You should use a different toilet from other family members. E. No visitors who may be pregnant. Ask. Precautions to teach. Problem. Radioactive iodine for hypothyroidism. Anything radioactive is very toxic. No exposure to other people. Solution. Cautions client should take with radioactive treatment. A. Incorrect. Breastfeeding is a big no, big contraindication. B. Correct. Disposing eatery will prevent exposure to others. C. Correct. Wash used items in separate laundry bins. D. Correct. Use exclusive toilets, separate toilets. E. Correct. Avoid pregnant women to avoid exposure to the fetus. Which diet education should the nurse include for a client newly diagnosed with hypothyroidism? Select all that apply. A. Do not drink caffeinated beverages and eat spicy foods. B. Choose 3 meals and 3 snacks daily that has increased protein. C. Clearly communicate why diet should be a low-carbohydrate diet. D. Consume a high-calorie diet about 4,000 to 5,000 calories per day. E. Encourage the patient to increase high-soluble fiber foods in the diet. Ask. Education to give. Problem. Hypothyroidism. Vital signs are high. Client is losing weight like crazy. Solution. Diet best for client. A. Correct. Caffeine and spice are stimulants. Can make things more elevated. B. Correct. Increased frequency of eating matches the increased metabolic rate. C. Incorrect. Client needs normal and high carbs. D. Correct. High calories for high everything. E. Incorrect. More fiber means more bowel movements. Which signs and/or symptoms are expected to be present in a client with Graves' disease? Select all that apply. A. Hand tremors. B. Irregular heart rhythm. C. Increased perspiration. D. Insomnia and anxiety. E. Exophthalmos. Obesity. Ask. Which sign and symptom? Problem. Graves' disease. Hypothyroidism. Solution. Manifestations that are likely with this hyperstate. A. Correct. Hand tremors from someone who is on hyperstate. B. Correct. Irregular heart rhythm and tachycardia, hyperstate. C. Correct. Increased sweating from increased metabolic rate and heat intolerance. D. Correct. Insomnia, hyperenergy, anxiety increase metabolic rate. E. Correct. Exophthalmos, eyes are exiting the body in hyperstate. F. Incorrect. Obesity is seen in hypothyroidism. Dear nurse student, keep pushing, lets the sky be the limit. Please don't forget to subscribe.